Hello everyone, this is the Theoretical Doctor and welcome back to my channel. If you're new here, welcome. This is a series on the chapter Infectious Disease of Chapter 7 of the STPM Semester 2 Biology series. Check out the full playlist on my channel. If you want access to flashcards on this topic and other videos, do click the link below. It is available on my Pinterest and slides on this topic are available on my website. In this video, we will be starting on infectious disease. In this video, we will be covering on the general overview of infectious disease, the terminologies used, and their meanings as well as the mode of transmissions. The general overview of infectious disease. Before I begin on what is infectious disease, what is the definition of disease or an infection? It is medically defined as any physical or mental disorder or malfunction with a specific set of signs and symptoms and excludes disorders resulting from physical injury. Basically, anything without accident. So it's a disease. It's a problem that's occurring by itself in the body. That's a disease. Now, what is infectious disease? It is a disease caused by an invading organism or virus that lives parasitically on or in the body that may be transmitted from organism to organism directly or indirectly. Basically, it's the disease that is caused by something, to be infected by something. And also pathogens. What are pathogens? Pathogens are organisms that causes the disease, such as viruses, bacteria, fungi, protozoans, flatworms, roundworms. So the pathogens are the enemies causing the problem. Now let's enter the terminologies used. So etiology. Etiology basically means what? Like what caused the disease. Epidemiology. Epidemiology means factors that contributes to the appearance of the disease. Or I would just like to think of epidemiology as location. Causative agent. Organisms which causes the disease. Vector. Organisms which carries the disease. It can be from one human to another human or from one animal to a human. So vector is basically the enemy, the transport of the disease. Incubation period. It is the period of time between the original infection and the appearance of signs and symptoms. So for example, if a person gets bitten by an Aedes mosquito today, they do not get the presentation, the signs and symptoms immediately. They may take a few days. So that period whereby they have gotten bitten, my English, where between the period where they were bitten and the appearance of the sickness. So that period in between those few days, that's the incubation period. Infective period, the time during which a person can pass the disease on to another person. So basically they are very contagious, very infectious. Carrier, a person who has been infected but shows no signs or symptoms but can pass the disease to another person. So they just carry the disease but they do not show any physical manifestation. Endemic, disease that is confined to a specific region or community. Epidemic, situation where the disease spreads rapidly through a large number of people then disappears. Pandemic, pan meaning global, an epidemic which spreads across the whole world. So I like to group these three together: endemic, epidemic, and pandemic. So endemic first, then epidemic, and finally pandemic. How I'd like to think of it is endemic is when it is a small village or a small place that's endemic. Epidemic, most likely the whole state or the country. And finally pandemic, the whole world. Symptoms, an indication of the disease which is not seen but reported by the patient. It's usually what they're feeling. So they will say, I'm having this headache, I feel nausea, there's a pain on my chest or my hand. Signs, visible expressions of the disease which can be seen by the eye. So we tend to confuse these two a lot, symptoms, signs. Symptoms is what the patient feel but we can't see. Signs is what we can see on the person having the disease. So for example, rash, they appear fatigued, they are limping, there's an enlargement or tumor, they are shivering, or they're having fever. Notifiable disease, a disease which must be reported by the doctors to the health authorities. So it's usually infectious disease which needs to be reported so that early control can take place. Prevention, measures taken to prevent a person from getting the disease. So for example, vaccination. And finally, treatment, measures taken to cure the disease or to alleviate the symptoms once the person has contracted the disease. Modes of transmission. So there are a few modes of transmission, and in this part here, I'm gonna give a few examples on air. So if it's an airborne disease, it could be virus, bacteria, or fungus. How it's being transmitted by air, it's through coughing or sneezing, or sometimes physical contact. So virus, you have varicella zoster, influenza virus, rubella virus, and polio virus. And the disease they cause, for varicella zoster, it's chickenpox, influenza the flu, rubella virus, German measles, polio virus, poliomyelitis. For bacteria, there's Bordetella pertussis, so they cause the whooping cough, Corynebacterium diphtheriae, causing diphtheria, and Mycobacterium tuberculosis, causing tuberculosis. Fungus, such as Candida species, for fungal infections like candidiasis, which is thrush. So usually when a person is asthmatic or they use an inhaler or maybe a smoker, if you actually notice their tongue, there's sometimes white patchy stuff on it. That's a thrush. So that's actually fungus growth. Contaminated water and food. For bacteria, you have Vibrio cholerae, which gives cholera, and also Salmonella typhi, typhoid. Infected animals, Proctotista, the Plasmodium species, causing malaria, and also dengue. But you see, dengue is actually a viral infection. This dengue here is just to give an example, like how animals, in this case the mosquito, can get infected and carry the disease, so they act as a vector. Alright, so if you've reached this point, thank you very much. Hit the like button if you found it helpful, as it does help in reaching out to others as well. Do support my channel by pressing the subscribe button so I will know, and it gives me motivation to continue producing content like this in the future. And finally, share this video to those who might find this helpful. See you in the next one.